And we continue our conversation here with Nick Tate, our Newsmax deputy health editor, who joins us from our newsroom, and Dr. Sanjay Jain, a board certified physician who is Skyping in from Washington, D.C. Dr. Jain, Dr. Russell Blaylock says the virus may not affect Americans the same way it has those in Africa because Africans typically have weaker immune systems. Do you believe that's accurate?
I think that's a stretch. It's this Ebola. There's obviously concern. If the CDC wasn't so concerned, he wouldn't be in Texas. And there's obviously concern. And the immune system factor, I'm not sure if I buy that. It's still a very virulent strain. So we can't really back down. We can't be complacent on this. We have to be very aggressive and treat it as if it's, life and death.
Nick, let me ask you something. Are we doing enough to contain this disease in Africa? Bill O'Reilly recently said that the United States should cut off travel to some countries. Do you agree with this, sir?
Well, we're spending hundreds of millions of dollars to really help the folks in Africa control the virus, and there is some evidence to suggest that in some places it is, in fact, being contained. But I think now the question is it going to spread beyond that region? Is the outbreak zone now going to widen? We know that there have been cases here in this country. So I think we need to be looking at more than just what hospitals are doing. I'm not going to say that I agree necessarily with O'Reilly that we should be cutting off travel, but we could be doing more in airports. We're now screening for a variety of weapons that people might be carrying and a variety of things. You can't bring small vials of fluids and personal care products through airports. Maybe we should be more closely monitoring for fevers and isolating some of those folks until we're sure. The thing has to be contained. This virus has to be contained. If it lands in a major metropolitan area, New York, Los Angeles, Detroit, Miami, we're in big trouble. So everything that can be done should be done. I'm not sure we're doing as much as we can in American airports.
Well, Dr. Jain, from a medical perspective, would it be wise to cease travel to Western Africa, to have American air carriers pull out their flights to that region of the world?
I'm not opposed to that at all. And why are we creating a thread from one side of the ocean to another and just connecting that link? And I'm not opposed to that at all. So there's a lot of differences of opinion, but I have young children and everybody has loved ones, and if we can keep it on that side of the ocean, let's do that. And let's keep our troops out there. Let's be very aggressive on that side of the ocean, really contain it there. I don't want to contain it in this country. That's how I feel.
Nick, it's obviously nowhere as serious as Ebola, but flu season is no doubt upon us. And a new study shows a cold virus can spread through an office in a few hours. What are some of the hot spots for germs in an office environment?
You're right about that. Let me just make one point clear. Tens of thousands of people die from flu every year in this country. So I believe it is a pretty serious condition that we need to take seriously. The new research you're talking about, University of Arizona researchers experimentally placed a virus on a door handle of an office with 80 people, and then they spent 4 hours tracking whether evidence of that virus contaminated other surfaces. And what they found is that about half of the people that worked in that office had the virus on their hands and were contaminated to some degree, and many common surfaces, doors to restrooms, coffee pot handles, phones, desks, computers, were all contaminated with this virus, which shows you that flu virus and viruses, not just Ebola, but all kinds of viruses, can spread like wildfire in an office environment or in a workplace environment. And that's why we really need to do everything we can to be protecting ourselves from not just Ebola, but flu, cold, viruses, and other things that can really be serious.
And Nick, as you were mentioning that, we took a look at the screen grab from our parent website, Newsmax.com, in particular the Newsmax Health portion of that website, which you assist in editing so capably. The minute that remains, Sanjay Jain, we heard Nick say, hey, we take flu for granted. Do you find that to be the case, sir?
Absolutely, because a lot of the deaths, especially in the older population, is from flu. And so, there's a lot of different strains of flu out there, and now we have some cases of younger children who are being affected by some of these flu strains, and they're actually really sick, and they're being admitted to hospital. So we always have to be on top of the different strains, and that's why the CDC and the World Health Organization keeping an eye on these different strains and always keeping these vaccinations updated is absolutely important. So getting the flu shot every year, definitely.
Dr. Sanjay Jain and Nick Tate, gentlemen, we thank you both for your perspectives on Ebola and the flu and reminding us just how dangerous the flu can possibly be. Well, we've heard the take from our two guests there. Olga and I had our questions. Maybe you have some comments and some answers for us. Why don't you tweet us your comments at Newsmax TV, hashtag America's Forum. There's also newsmaxtv.com/comment. And don't forget Facebook. Our faces return on the other side of this break.